Hi there, I'm Coach Max and I'm thrilled to welcome you to our cardiac rehabilitation follow-along session. If you use a heart rate monitor, a fitness tracker, turn it on now. We want to get a baseline heart rate even before we begin to warm up. Let's talk about exercising safely, especially with heart conditions. Number one, you want to wear loose clothes that don't limit your movement. Number two, what intensity should I aim for? A great way to gauge your exercise intensity is the conversation test. Essentially, you want to aim to work out at a level where your breathing is noticeably deeper than usual, yet you can still hold a conversation. It's okay if speaking requires a bit of effort, but you shouldn't be so out of breath that you can talk. Number three, remember to have a water bottle close at hand to stay hydrated. Number four, always keep breathing. Whether during cardio or strength training, if you exercise while holding your breath, you could trigger abnormal heartbeat, not something we want. What's okay and what's not okay? Feeling warmer, noticing your heartbeat going up, experiencing moderate breathlessness during a workout, perfectly normal signs that your heart is getting a good workout. However, always listen to your body. If you experience severe shortness of breath, chest pain, irregular heartbeats, dizziness, or extreme tiredness, anything that feels off, really, please pause and take a break. If these symptoms ease quickly, you can cautiously continue. If they persist, safer to stop and save it for another day. Don't forget to report any unusual symptoms to your healthcare provider. Jot them down at the end of your exercise session to keep track of them. So, with all that in mind, let's start this exercise session focused on safety and boosting your heart health. Let's go! Hello everyone and welcome to today's session. I'm lucky to have Eva with me today, who is going to show you the movements using a chair for support, and I'm going to be doing the regular movements. You're going to need water bottles for today, 2 of them, and don't forget to start your heart rate monitor because we want to get these numbers before we start warming up. So let's go for it. The first movement in our warm-up would be the side steps that you know, okay? So you can either do them standing up, using a chair, or there for 1 minute. Let's go. Gonna get this heart pumping gently. You can even lift your arms up if you want a little more challenge. It's an intermediate level today, so not for beginners. If it's your first session of, for instance, home-based cardiac rehab, I suggest you start with our beginner classes because this one is a little more challenging, and there I am, I already knocked out my first bottle of water for today. How surprising. All right, 20 more seconds before we switch to a back lunge. Couple more. All right, so our back lunge, remember, I want you to keep your chest up straight, your core tight, and I want you to go down, not too low, wherever feels comfortable for you. You can go to the floor. Wow, I have trouble doing that. Good. While we're doing that, let me walk you through today's menu. We're gonna have 4 different movements, working your lower body, upper body, 40 seconds work, 20-second rest. We're gonna go through all this list of movements twice. So it's not that long, but you're gonna get a good workout because I'm going to throw you a twist right before we start that I'm sure you're gonna like, or not. Couple more. All right, that's it for our warm-up, folks. Let's dive into our workout. We're gonna start with forward lunge. So you hold a chair, let's go to the front, exactly, not too low. Find the right movement that feels good for you, right? That's it, there you go, forward. All right, here's the deal for today. What I want you to do, if you can, for the rest of the session, the rest of the workout, so hold your water bottle and not let them go down. All the movements done with your water bottle if you can. Obviously, if you're holding a chair, forget about it. That's fine, still gonna get a good workout. All right, we rest 20 seconds. And then we're gonna move to the side steps that we did during the warm-up with a twist, because now you have water bottle too. We're gonna start in 5 seconds. All right, side steps, let's go. Yes, I want you to lift your arms with the water bottle while you're doing these side steps. I know it's challenging. If it's getting too hard, that's fine. Take a break, but maintain those side steps. Keep moving. Couple more. All right, and rest. The next movement is a bent over row. So I'm gonna ask you to come sit on the chair, grab your water bottles, and we're gonna do the same movement, only Eva will be sitting. So bend over a little bit, lift your elbows, kick back. That's it. Bring it back in and down. Up, back, and down. Remember, look at my back. It's straight. It's not arched. I really want you to lift, pull these shoulder blades out to keep it back straight. If you can't bend that much over, that's fine. Just go a little more vertical, perfectly fine too. The first part of the movement is really to activate your back muscle. The second part is your triceps. So it's a complete work of your posterior chain for the back and triceps. Yep. Couple more before we rest. Good. All right, next one is knees up, hands across the knee. Yep, no, you don't need water bottles, you can put them down. There you go. So if you're seated, no water bottle, you can go above your knees. That's it, with a twist. If you're standing up, let's go. We want you to keep your water bottles if you can. If not, perfectly fine to put them down. That's it. Right here. Look at my hands. Right outside the knee. Right, the other way around. That's it. The other leg. Outside the knee, that's up. There you go. Yes, there you go. I knew you were gonna figure it out. And we take a break. All right. I know this is challenging, I get it wrong all the time, don't worry. All right, 20 seconds of break, and we're gonna go back to our forward lunge so you can go back to your initial movement. And it's the second round of 2, which means that it's the last set of forward lunge. If you have your water bottles, obviously, I want you to keep them in your hands. And we go for 40 seconds of forward lunge. Remember, I want you to be up straight. How you hold the bottles is up to you. It's a nice little leg activation there. It's gonna help you get stronger, walk further, stronger. Oof, and ease those pains you might get when you walk, hopefully. Good, 20-second rest. Side steps, you know them, good. All right, 10 seconds, we're gonna start the side steps. Remember, if you have these water bottles, you want a bit more challenge, arms up every time you kick out. All right, so let's go. 40 seconds. Remember how you feel, how you should be feeling in terms of intensity. The talk test. If you can talk with me, but you don't want to talk, means you're exercising at the right intensity. If you can talk without stopping, not intense enough. Don't be out of breath either, obviously. Oof. And break, 20 seconds. You can come back to your chair and we're gonna do some bent over rows to triceps extension. All right, so bend over a little bit, back straight, shoulder blades tucked in, and let's go. So up, kick out. That's it. Down, up. Keep your elbows to your body, close to your body if you can, and kick up. Look at my elbows, they stay tight. Kick up and back down. Good. Couple more. Actually, give me one last, and we're good. Oof. Good. All right, a little bit of rest, and we're gonna switch to our knees up. Eva's nemesis. So remember, the knees that's up, the hands go right outside of it. There you go, that's the right way to do it. If you have your water bottles, keep them in to give you a little push, little extra push. Here we go, 40 seconds. Remember, if at any point you feel anything wrong, dizziness, super tired, abnormal heartbeat, take a few seconds to rest, and if it persists, call it a day and report back to your provider. Anything that something feels off, you need to tell your provider. They need to be aware. Oof. Almost done, Eva. Keep it up. Good. Couple more, 2, and 1 last, and rest. Good. All right. We're done with the workout. Great, yay. For the cool down part, you can stay seated. I want you to cross your legs, one on top of the other. So bring this, cross your legs, and I want you to go gently give a pull in this direction. There you go. So I want you to cross your leg and gently pull that way when you're sitting down. If you're standing up, look at me. I'm gonna cross my leg and I'm gonna go on one side trying to reach my knee. Gonna hold it there for a bit. Back straight. I don't want you to be bending over like that. It should look like that. All right, switch side. Switch leg, boom. Bend over, sit, pull. If you really want a bigger stretch, you can really fold completely to the floor. You're gonna feel it in your hamstrings. But otherwise, just crossing your legs and bending to one side is enough. Ooh. All right, release. The next stretch is the hamstring. So you've done it before. It wants you to scooch to the end of the chair. Extend one leg, toes pointing up, and knee straight, leg extended, sorry, that's it. Push right above your knee, put your hand on your thigh to make sure your leg is fully extended. That's it. Getting a good stretch. Other leg. Ooh. We have one last movement after that, and we're done for today. You did a great job. It's tough when you keep the water bottles in your hand. Get this extra push that you really need. Okay, release. For the last minute, I want shoulder rolls. Wide towards the back. So lift, ooh, and bring the shoulder as far back and down as possible. Keep breathing. It's our recovery. All right, switch direction to the front. Bring the shoulder as further front as you can, and then back. Couple more. All right, good job, Eva. That's it for today, folks. You got stronger, your heart got stronger just by this exercise session. So if you keep packing them throughout the week and you keep working out at least 5 days a week, you are going to get your heart stronger, which is a recommended, by the way, time of workout in a week is around 75 to 100 minutes of exercise. That's what you should be aiming for. Have a great day, everyone. I'll be seeing you soon. And in the meantime, take care of your heart. Ciao.